Now we're going to discuss the clinical features. So the signs and symptomatologies are even going to be focused on when you get these patients of epilepsy that are basically giving you a history of any kind of seizure activity. Over here, we must know how to classify the epileptic seizures. For instance, we can classify them as focal seizures. Then we have another major group of epileptic seizures that are basically known as the generalized seizures. So the generalized seizures can be then again subclassified into the tonic seizures. We can have the clonic seizures. We have another group which is known as the myoclonic seizures. Depending upon the kind of symptoms that are predominant in that particular individual, we're going to label them which specific group in this category they are going to lie upon. So the symptomatologies are going to be focused on whenever we have these patients of seizure activity, either the focal or it can be even the generalized seizures. So on the other hand, we have the epileptic syndromes, and we even classify people according to the age group that they belong to. Even we have individuals who are suffering from the partial seizures, and they have their own set of symptoms. So generally speaking, what kind of clinical features you're going to see in these individuals is very interesting. A lot of individuals would just give you a history of temporary confusion. So this can be one of the predominant symptomatology that is seen in the individuals. Then we have the patients who are only suffering from the absence seizures, and patients who are suffering particularly from these absence seizures give you a history of a staring spell. So this is one of the kinds that we can go through over here. Then we have the jerking movements. So as I've already emphasized on the fact that we can have the tonic-clonic seizures. Even in our case study, we went through the particular signs and symptoms in which Sarah basically had the twitching movements of the face of a particular side. Left side was predominantly involved over here. So if the patient is suffering from some sort of jerky movements, tonic as well as clonic, or even it can be the myoclonic involving the particular set of muscles involving a particular limb area, you can to focus either this kind of the twitching movements was also coupled up with some sort of cognitive behavioral disorders or not. Thought processes and the orientation in time, place, and person is also seen over here. So this is again very important to correlate the different sets of signs and symptoms over here, and the cognitive functionality is also going to be assessed over here in the particular patient, because it is the major factor that is considered whenever we have patients of the focal seizures, or the group or the category in which we define that the patient has focal seizures. Sometimes they have the cognitive impairment, and sometimes they're not suffering from the cognitive impairment, and they are well oriented in time, place, and person. So this is very important that you focus on the associated features as well. Then in a lot of patients, they would give you a history of a loss of consciousness. So even that is going to be taken into account. An unknown fear, a state of confusion. This is something that is basically associated with the abnormal sensations that the patient is having. So usually the fear is caused due to the abnormal sensations, due to the hallucinations, or due to the kind of aura that the patient has before he or she goes into that seizural activity. So this is how the patient would basically describe the feeling that he or she has. Either the patient is going to be anxious, fearful, as we even saw in our case study. And then we have patients who are anxious. So this anxiety and fear is basically contributed due to the aura that the patient is suffering from. And usually the typical lobes that are involved, specifically the temporal lobe, the median temporal lobe, as well as the frontal lobe, is sometimes associated with this associated fear and anxiety that the patient is suffering from.